So this is a new series of videos. We're going to look at key communication skills and how you can use them in everyday consulting, but also for your exams. So if you find this helpful, do like and subscribe to the channel so you get updated as I post new videos. So the first thing we're going to look at is ABC. Always be communicating. What do I mean by this? So let's say now you're talking to a patient and sometimes they ask you a question and you need to look something up. If you just look away and start looking something up on your computer or in an exam setting, let's say you want to make some notes. If they're talking to you and you just suddenly look down and you're writing something, they might feel like, I've just asked you something and you're ignoring me now. It might come across a little bit abrupt or a little bit rude, or that you're not paying attention to them. So always be communicating, i.e. let them know. I'm just going to make down some notes so I don't miss anything important. I just need to check the dose of that drug, let's say in real life, and you're looking up the BNF online, for example. Just give me a moment so that they see now why you're looking away and that you're doing this so that you can answer their query. This also applies where it might not be clear to the patient why you're asking certain questions. We'll talk later in a different video about the skill of signposting. But in terms of always be communicating, communicate what's going through your mind. I'll give you an example. Patient's got chest pain and they're worried that it's related to their heart. However, you think it might be dyspepsia, which can also present as a pain in the chest, but a burning type pain, and that's how they've described it. So now, they're worried about their heart. If you now suddenly say to them, I want to feel your tummy, because you're thinking, okay, I want to rule out a rare but serious cause of burning type pain, and that is, if they've got an epigastric mass, could it be a stomach cancer, for example, all right? But they're worried about their heart. Do you see? So if you communicate, I know you've said that you're worried about your heart, and I can see why you'd be worried, given you've had family history and, chest pain often is something people associate with heart problems. However, because you've told me that the way that this pain feels is a burning pain, and you also mentioned it's not related to when you're doing exercise, it sounds a lot more like it might be coming from your stomach. So in order to rule out a rare but serious cause of this type of symptom, it'd be helpful if I could feel your tummy. Would that be okay with you? Can you see the difference? You're communicating what's going through your mind. The patient can't read your mind. Now they understand, and actually they think, oh, the doctor's being really thorough here. They have picked up what could be going on and they want to rule out a rare but serious thing. Okay? So ABC, not airway, breathing, circulation. Of course, that can be important in some context, but in the context of communication, always be communicating. Okay, so that's the first video. I'm going to shoot a whole series of these very short videos covering different key communication skills and how you can implement it in real life and for your exams. If you did find this helpful, do subscribe to the channel for more.